Motivational interviewing is a counseling approach designed to help individuals find their own motivation to make positive changes in their behavior. It focuses on collaboration between the counselor and the individual, emphasizing the person's autonomy in decision-making. This approach is particularly effective for addressing behaviors that are difficult to change, such as unhealthy eating, smoking, or lack of exercise. Motivational interviewing uses open-ended questions, reflective listening, and affirmations to encourage individuals to explore their thoughts and feelings about change without feeling judged or pressured. Motivational interviewing originated in the 1980s as a method to support people struggling with addiction. It was developed by psychologists who noticed that traditional methods of confronting and advising individuals often led to resistance rather than progress. They observed that when people feel understood and supported, they are more likely to take ownership of their decisions and commit to change. Over time, motivational interviewing expanded beyond addiction treatment and is now used in various fields, including healthcare, education, and social work. Now let's look at some examples. In a healthcare setting, a doctor might use motivational interviewing to help a patient with diabetes manage their condition. Instead of directly telling the patient to eat healthier, the doctor might ask, "What challenges do you face when trying to stick to a diet?" This question encourages the patient to reflect on their own barriers and think of solutions. In education, a teacher might use motivational interviewing to support a student who struggles with completing assignments. They might say, "What do you think is getting in the way of finishing your homework?" By listening to the student's perspective, the teacher can help them explore ways to overcome obstacles. Now let's look at some strengths of motivational interviewing. One strength is its emphasis on empathy. By creating a non-judgmental and supportive environment, counselors can build trust with individuals, making them more likely to open up and share their true feelings. This approach helps individuals feel heard and understood. Another strength is its flexibility. Motivational interviewing can be adapted to fit a wide range of settings and issues. Whether used in a medical office, a classroom, or a therapy session, this approach works because it is centered on the individual's unique needs and goals. This adaptability makes it a versatile tool for professionals in various fields. A third strength is its focus on autonomy. Motivational interviewing respects the individual's ability to make their own choices. By encouraging people to find their own reasons for change, it increases the likelihood that they will stick to their decisions and follow through with their plans. However, motivational interviewing is not without its weaknesses. One criticism is that it can be time-consuming. Building trust and helping individuals explore their motivations often requires multiple sessions, which can be challenging in settings where time is limited, such as busy clinics or schools. Another weakness is that it relies heavily on the counselor's skill. Not all professionals are trained in motivational interviewing techniques, and without proper training, the approach may be less effective. Misusing techniques such as not truly listening or unintentionally pressuring the individual can hinder progress. A third weakness is that motivational interviewing may not work for everyone. Some individuals may be resistant to self-reflection or unwilling to engage in open dialogue. In these cases, other methods may be needed to help them move forward. Now let's explore some alternatives to motivational interviewing. One alternative is cognitive behavioral therapy, CBT. CBT focuses on identifying and changing negative thought patterns that lead to unhelpful behaviors. Unlike motivational interviewing, CBT often involves structured exercises and homework assignments to help individuals practice new skills.